Thank you. Why don't we continue with Casey?
Great, thank you, and thank you all for having me here. I'm going to talk about something a little bit different. A few months ago, I had the pleasure of seeing Don Berwick speak, and he had updated his talk on the triple aim, now the quadruple aim, and he really focused on how the medical world is moving within this new value-based paradigm. He really highlighted a series of programs that are focused on patient-centered outcomes. So he talked about a clinic in Germany that dealt with prostate cancer, and they decided to start thinking about what actually matters to the patients that they treat. And they talked about improving erectile dysfunction rates and also incontinence. And you could see that their improvements in those areas skyrocketed compared to all the other clinics treating prostate cancer across Germany. He mentioned, and I think Dr. Snyder said something similar, that dentistry is about 20 years behind medical. And in that vein, we really haven't started looking seriously at the outcome measures that patients care about when it comes to oral health. So earlier today, you saw some of HPI's work with Dean Schillinger's presentation. He was showing you some of the oral health measures that we measured about 3 years ago now. So do you have experience with dry mouth? Do you have issues with embarrassment due to the condition of your mouth and teeth? We also asked about ability to go interview for a job due to the condition of your mouth and teeth. Issues like that that sort of impact your world beyond just the clinical things that we think about in the dental office. And I would say that that is one of the main areas that we should continue to focus as we move forward. And I wanted to highlight the new oral health definition from the World Dental Federation. They said, oral health is multifaceted and includes the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence and without pain, discomfort, and disease of the craniofacial complex. Those are the things that matter to people, and I think that idea is how we're going to get more patients to actually utilize care. It's also a concept to think about as providers. When you're communicating to your patients why it's important for them to come in and see you and adhere to your treatment plan, perhaps it would be better to talk about why those things should matter to them. I see you're losing a lot of weight. Is this because you have pain when you chew? Are you avoiding eating and keeping up with your nutrition? Here's how my treatment plan can help with that, things of that nature. Along those same lines, I really think we need to start looking at why people don't seek care, even if they have a dental benefit. And I know my own shop, as well as many other researchers, often highlight cost as the reason why more folks aren't seeing the dentist regardless of their insurance or benefit state. And I think we just need to push that agenda a little bit further to look at, is it because they feel like they can't afford to come in and perhaps need to access treatment beyond a prophy and an exam? Are they that health literate to know that their benefit doesn't actually cover those things? Or are they actually substituting within their basket of goods saying, you know what, I can go to the dentist this week, or I can go buy a new phone, a new pair of shoes? And what does that really say about the way that our society values oral health and treats it differently than whole body health? How can we shift that conversation? And I think a lot of that goes towards all of the issues that we've discussed at length today with the separation of dental from medical. So if we really want to integrate these two, we're going to have to start really buckling down on not separating dental in any capacity. And that sort of touches on a third point I wanted to bring up, which is we need to do more in terms of measuring ROI of integrating oral health into whole body health. And there have been plenty of excellent studies done. We've referenced them today, the Avalier study, United Health, in terms of the impact of dental on lowering healthcare costs for diabetic patients, individuals with heart disease. There's been a few out of HPI as well that have found annual savings of up to $1,800 a year for diabetic patients. I think we need to expand that ROI, and that's why I'm so excited about Marshfield Clinic, Kaiser Permanente, Health Partners. These are the sort of pilots, if you will, for the dental industry in terms of really proving why it's important to have that integration. And I can't wait to see some of that research come out that looks at a broader population beyond those suffering from, very important and very expensive chronic conditions. But we need to start rolling this out so that it's all encompassing if we really want people to take their oral health seriously. And then finally, one policy plug, I guess. I'm sure most people in this room are aware of the momentum behind adding a dental benefit to Medicare. So the Santa Fe Group, Oral Health America, AARP, several other advocacy organizations, consumer organizations, and policy groups are really taking this seriously. And it actually goes back to the important work that we've done in diabetes. I think that's where we're going to start seeing some inroads into the Medicare world. So there's a pretty concerted effort to add dental benefits to Medicare relatively soon for those Medicare individuals that do have diabetes, which should actually impact more than half of the Medicare population when all is said and done. I think they're trying to add a few other chronic diseases into that mix, and then using that as a platform to roll a dental benefit out to the entire Medicare population. And what we know when we look at the US healthcare system is that Medicare sort of sets the stage for the rest of the healthcare landscape, and the changes that happen there will impact everything else from Medicaid. So maybe we'll actually start seeing mandated dental benefits in Medicaid across all states, private plans, and I guess we'll see where that goes. And with that, I'd like to turn it back over.
Okay, we're going to come back to the Medicare, Medicaid policy issues in a minute. But in the meantime, let's continue with each of our panelists. Dr. Lambert, from your perspective, why is this important?
Thank you.